My name is Margaret Ellis Raymond. I am a publishing consultant and author, and I was born with Tricuspid Atresia. If this is your first video, welcome to my channel. I had a friend come up to me the other day and she said, I love watching your videos, but I don't quite know what your heart condition is. And I said, there's a video coming out about that, and this is that video. And what better week to put out this video than Congenital Heart Defect Awareness Week and also Heartmonth. All right, ready? Here we go. So in order to understand a heart defect or a heart condition, you need to first know the normal pathway of the heart. All right, so this is a lovely little diagram of the blood flow in your heart, and you will notice that you have two options of looking at this diagram. You can look at the boxes with the words that describe the blood flow with the arrows, or you can just look at the heart and the arrows. Blood comes into the heart by way of the superior and inferior vena cava. Those two veins bring blood into your right atrium, and then from your right atrium, your tricuspid valve opens like a door, and it allows the blood to go down into your right ventricle. The tricuspid valve then closes, and it's called tricuspid because it has three doors, essentially, like three folding doors that close on itself. So it stops the blood from going back up into the right atrium. That's what the tricuspid valve does. Once the blood is in your right ventricle, your ventricle gives a pump and it brings blood up into your pulmonary artery, and then that blood goes to your lungs. So now the blood comes in from the pulmonary veins. You have four of them. They're tan ones right on each side over here. The blood gets dumped into your left atrium chamber, and then your mitral valve, which has two doors, opens and lets the blood down into your left ventricle. The mitral valve closes and your left ventricle gives a big pump, and it sends the blood up into your aorta. From your aorta, the blood goes to the rest of your body. So that is normal circulation of blood in a normal heart. So if you were to take a look at the title of my condition, which is Tricuspid Atresia, you will see that the word atresia is present. And when you search atresia in Merriam-Webster, you get the definition of absence or disappearance of an anatomical part. So in the title of Tricuspid Atresia, you have a answer to what it is right off the bat. Tricuspid, you know now, is a valve in your heart, and atresia is the absence or disappearance of an anatomical part. So with that all connected, you can assume that tricuspid atresia means the absence of the tricuspid valve, which is exactly what it is. Certain people have different iterations of tricuspid atresia. There are specific extra defects that can come along with tricuspid atresia. Please note that each person who has tricuspid atresia might have it slightly different than what I'm about to describe to you. As you may have guessed, my logo is specific to tricuspid atresia. I reached out to Kristen, and she was able to come up with a wonderful logo for me, and I couldn't have asked for better. So check her out on Instagram. The link is in the description of all my videos. The first thing you're going to notice is that this heart looks very different from a normal heart. You're going to see that the right ventricle is basically grayed out, or in this case it's a shade of purple, and that means that it's solid. It's not pumping. It never developed. The reason that it never developed is because the tricuspid valve never developed. So that's the next thing you will notice, is that there is no tricuspid valve. There's no door on the right side of the heart where the blue blood is. Now, I had her draw it based on 2 defects that are present at birth with tricuspid atresia. The first is a VSD, and the second is an ASD. The first defect is an ASD, or an atrial septal defect. An ASD is a hole in the wall between your left and right atria, or the top 2 chambers of the heart, which is a little harder to see in this image, but it's right about here. The next defect that most individuals with tricuspid atresia are born with is a VSD, which is a hole between the left and right ventricle. So the blood comes into the right side of the heart, just like it does in a normal heart, through the superior and inferior vena cava, and it comes into the right atrium. So next you're going to notice that the blue blood is going through the ASD, the hole between the 2 top chambers, and it's mixing with the red blood. Blue and red, when you mix together, makes purple. So doctors like to describe patients who have tricuspid atresia with purple blood. It's not actually purple, it's just oxygenated blood from the lungs and less oxygenated blood from the body mixing together in the atria. That goes down into the left ventricle, and then that blood gets pumped up into not only the aorta, the red artery here, but it also gets pumped into the pulmonary artery, the blue artery, right here. So what this means is that somebody who has tricuspid atresia is basically walking around with blood that is less oxygenated than others. So now I'll hit play and we can watch the logo in slow motion and watch the blood flow in a patient who has tricuspid atresia. Okay, so I want to apologize in advance. I don't know all the information that I could about my surgeries. I know the names of them, and I'm going to try my best to describe them, but I know I'm going to either A, say the name of the surgery wrong, or B, describe it a little bit differently. Definitely check out the description of my video because there are links describing the various surgeries in detail and with better explanation than I am able to give. I'm going to try my best, but I am no medical professional, so here we go. I found an old document indicating exactly what surgeries were performed. You can hear the old paper. They do indicate that I was born with pulmonary stenosis. What that means is I was born with a narrow pulmonary artery right here, so it's a skinnier opening to allow the blood to go into the lungs. The other thing is the bulboventricular foramen. That's beyond my comprehension. I know that restrictive obviously means, well, restrictive, and foramen is a hole, and bulbo, I would assume, means like bulbous. I'm not 100% sure, and it probably has something to do with the ventricle, because ventricular, but I'm not sure, so I'm not going to try and describe that one. My first surgery was performed 4 days after birth, and it's called a Blaylock tussing shunt. I totally said that incorrectly. So this operation is to help babies that are born blue. So my blood has less oxygen because it wasn't reaching my lungs, so therefore my skin color looked bluer than other babies. And this procedure creates a pathway for blood to reach the lungs by connecting the right subclavian artery here with the right pulmonary artery. And this way, blood that is more oxygenated, or red blood, is traveling through the shunt. So it's basically mixing that blue and that red so that it's more oxygenated. And this is a surgery that is going to be replaced by the second surgery a couple months later. So the second surgery that's usually performed on infants who have tricuspid atresia is a Glenn shunt. And this usually happens at about 4 to 12 months of age, and it replaces the Blaylock tussing shunt. So that shunt is removed and the Glenn shunt is placed. So what is a Glenn shunt? This is when the doctors take the superior vena cava here and connect it to the right pulmonary artery here. They basically fuse them together at a certain spot, and then blood from the head can passively flow into the pulmonary artery and go to the lungs to get oxygen. So this surgery basically is another stepping stone, and it helps create the necessary connections for the final operation, which is the Fontan procedure. The Fontan procedure is the third and usually the final operation for someone who has tricuspid atresia. This Fontan procedure is in addition to the Glenn shunt. So there's a few variations. There's classic, lateral tunnel, and extra cardiac. So when I was 3 years old, I had my Fontan completed, and they chose to do a lateral tunnel fenestrated Fontan procedure. So in essence, the Fontan procedure redirects blood flow so the single ventricle heart pumps blood only to the body. The inferior vena cava is cut, and doctors create extra tubing so it can connect to the pulmonary artery up here. I had a fenestrated Fontan. A fenestration is when doctors create a hole in the extra tubing that they made, and they also create a hole in the right atria and sew those two holes together. And this fenestration is a extra shunt, or connection for the blood from the atria to passively flow into the inferior vena cava, where it can then travel to the lungs. This video was really difficult to create because I was using copyright-free images, so the challenge was put to me by myself. And hopefully I did an okay job showing you what each surgery is like and a little bit about my condition, and hopefully it all makes sense. I know that I've learned a lot from doing this research. That is one thing that I'm using my YouTube channel for, is to push me out of my comfort zone and expand my knowledge on my condition. And this video has definitely helped me do a deep dive into all the surgeries, because I definitely did not know half of the information that I just explained to you 2 weeks ago. Thank you so much for watching, and hit that like button, subscribe, and please post a comment and share with others who you know have heart conditions or are just interested in learning about this. I want to build my community on YouTube, and I hope to do that with your help. Happy Valentine's Day, happy Congenital Heart Defect Awareness Week, and happy Heartmonth. Keep being your unbeatable self.